Mr. Bodybuilding, not body breaking, has apparently hurt himself when training. Last week on Monday, during shoulder press, I seem to have tweaked the right side of my neck. Today is Sunday the following week. So we are almost 7 days post-injury, and we're going over how injuries occur even though we are doing an exercise that is typically done. All I was doing was a standard shoulder press, a standing overhead press, and I seem to have tweaked somewhere between my lower cervical and upper thoracic spine. Why is that, even though I do tons of internal tissue-specific training? It's because sometimes there's no rhyme or reason, and when demands exceed capacity, injury occurs. And so we're gonna break down what should we do when we have an injury occur. And when we talk about injury, it's a spectrum. We have some injuries that are catastrophic, say a disc herniation, a disc injury, things of that nature. And then we have tweaks and aches and pains. I would say my neck pain is somewhere in the 6-7 range. I lack a lot of range in the cervical spine, a lot of range in the thoracic spine right now, and a lot of range in my scapula. And so when we're trying to assess what the current status of the injured joint is, the injured tissue, we generally do CARs, controlled articular rotations. And CARs are simply just an exploration practice where we can see what range of motion is available in my neck currently. So as you can see, when I move my neck laterally flexed to the right, my right, your left, I have a fair amount of range of motion. But right now I feel a pinch on the right side of my neck. In a typical neck CAR, we're moving our neck through all of the ranges of motion of flexion, rotation, lateral flexion, and extension. But what we're gonna do is break down the neck CAR into subsections. And so again, if I laterally flex to the right, you see that I have some visible range of motion there. But internally, I am getting a pinch on the right side, almost in my shoulder blade. And now when I laterally flex to the left, that is all the range I have. I feel nothing on the left side, and I feel what we would call range limiting tissue on my right side. So I know the right side of my neck's what's injured, and that injured tissue is reducing my range of motion to do lateral flexion to the left. When I do rotation, when I rotate to the right, you see I have pretty good range of motion. I can almost see perpendicular to myself in the wall over there. But again, I feel closing side restriction, almost a pinch. I don't feel a healthy contraction. When I rotate to the left, I definitely can't get as far. I can't see the same point on the wall to my left as I can to my right. And again, I feel nothing on the closing side and a ton of restriction on the open side. So again, we would call that range limiting tissue. So currently, right now, lateral flexion seems to be the most influenced. You can see I don't have much range there. And when I rotate, that same subsection of tissue is what's restricted. The other areas that we want to look at is flexion and extension. Extension, ironically, doesn't really hurt at all. And honestly, I'm not sure why that is. Again, injuries often don't have any rhyme or reason, and they can occur from reoccurring tasks of something that you're comfortable with. It doesn't have to be anything new or crazy for you to injure yourself. And in extension, I feel closing side, but it doesn't feel like a pinch. It feels like just a shortening. The same way you would shorten your bicep on a bicep curl, I'm shortening my cervical extensors, and it seems to feel fairly healthy. To contrast that, when I flex my neck, I can't look down any further than this. If I look down any further, I get a ton of open side restriction. Once again, range limiting tissue, and it's almost exclusively on the right side relative to my left. And so again, flexion is limited. We also see restriction in lateral flexion and rotation. And so it's pretty clear that the right side of my cervical spine is what's inhibited right now. And we're gonna go over what it should look like when we're trying to rehabilitate this within a week outside of the injury. So when people injure themselves in the gym, usually they tend to keep it still, they immobilize it. And there's merit to that depending on the severity of the injury. But when we have injured tissue, our body often turns it off. It disconnects it and it creates restriction so to prevent injury from occurring further. So we don't re-injure or exacerbate the injury any further than it currently is. It's our job as part of the rehabilitation process is to kind of show that our body that this is safe space. This is trustworthy space and it's not a danger zone. So again, we're we're gonna be looking to release the range limiting tissue, the tissue that's inflamed. We have no expectation for this to be totally fixed today, but the goal is to get more range of motion, get more comfortable in that range of motion, and basically stimulate that tissue so our nervous system can kind of drive resources to it for it to heal, as well as build trust with our body to release the range limiting tissue. And again, in this case, it's lateral flexion, rotation, and linear flexion. And so what we're gonna do for that is a bit of spine segmentation. And so for spine segmentation, we typically start with the bottom and lumbar spine and work our way up one by one. What we're gonna do is a different variation of segmentation where I'm kneeling like this and I'm simply just gonna bring my neck down until I feel the range limiting tissue fully lengthening. And once I feel the full lengthening of it, where I feel my chin trying to touch my sternum, all I'm gonna do is begin extending at the cervical spine and extending a little bit at the thoracic spine. And so again, I'm in extension, I'm feeling the back of my neck fully shorten. There's a bit of discomfort there, but nothing crazy. And then again, I'm going into my danger zone where I am now flexing my neck. And as I flex my neck, I feel the range limiting tissue limiting me again. And my job here is to shorten anterior spine tissue, anterior cervical spine tissue. And as I look down, I feel again the danger zone lengthening, my range limiting tissue lengthening. And all I'm trying to do is breathe, relax, and again, show my body that it is safe space. And again, as I do this, I still feel the range limiting tissue, but it seems to have released a bit since I've started doing this. And again, when I feel like I can't flex any further, I'm gonna begin looking up and simply just extend. Again, the goal here is not to drive intensity, it's to just showcase to the body what movement is supposed to look like, to rebuild trust within the nervous system, drive resources, blood, synovial fluid to those tissues in an effort for it to heal at a faster rate. And again, if we immobilize during injury, we'll often see range of motion being severely limited than if we maintain and try to preserve our movement through injury. And so again, as I do this, I'm just looking to get a little bit further into my danger zone because every injury is different from person to person, from injury to injury. And so my danger zone, as you guys saw when we started, is as I go into cervical flexion, I was super limited through here. I can say definitively right now that I have more range than when I started. My chin is almost touching my chest. I still feel the range limiting tissue pulling, but not to the same extent. And again, as I hit my end range of motion, I'm gonna focus on my breathing. Trying to relax and breathe into that space. I would definitely be more deliberate about breathing if I wasn't talking to you guys as I do this. So this is obviously not ideal. And again, I find the end of my end range of motion in the danger zone. Big deep breath. And then again, revert back to shortening that tissue. Remember, when we're moving joints, all we're doing is shortening tissue and lengthening tissue. What I can also do now is add complexity to the movement. So we talked about earlier how my lateral flexion was limited and flexion. So what we're gonna do now is laterally flex my neck, and then I'm gonna begin looking down as I'm laterally flexing. And when I add this degree of lateral flexion and some rotation, I feel a very different sensation in my danger zone than I do if my head is straight. So right now my head is neutral in flexion. I feel the right side of my neck pulling some, but as soon as I do this laterally flex motion, I get a very different sensation, and I'm clearly touching the injured tissue. And as I look up, I'm almost getting pinching in my right shoulder blade and in my thoracic spine. I'm gonna stop short of that, just a bit shy of the end range of motion. Take a big deep breath and begin flexing. And again, I'm trying to shorten all this anterior tissue in an effort to maximally lengthen the posterior tissue. And again, finding the end range there to expand my workspace, how much range of motion I'm exploring. I'm gonna begin rotating the other way. And as I pull up through here, I feel, again, a ton of restriction through my cervical spine. And so again, this injury doesn't seem to have occurred strictly at my neck. It seems to have occurred a bit at my thoracic spine. And so as I explore this, I am simply assessing. A lot of this movement stuff, a lot of this joint exploration stuff is an ongoing assessment. And all I'm trying to do is expose the injured tissue. Again, if we immobilize for too long of a period of time, then we know we're gonna lose that range of motion when we eventually are cleared to return to play and you resume training again. And so that's how we're gonna go ahead and expose that range limiting tissue on the right side of my neck. So again, to recap that first segment, we know flexion for myself is very limited. And you guys could probably see that if I did a side-by-side, I may edit that in now that I'm talking about it, I have way more flexion right now than when I started. Right now when I'm leaning forward and I'm flexing my neck, I can almost get my chin to my sternum. And what am I feeling now? Because this is an ongoing assessment as I'm training the injured tissue. I don't really feel my neck limiting me anymore. I feel more thoracic spine, scapula, a different subsection of tissue than I did initially, and that's kind of the goal. It's part of the training stimulus. What we're gonna do now is focus strictly on lateral flexion. So we can do passive stretching paired with isometric contractions to, again, just simply stimulate the injured tissue, but within your means. If you are so injured that you get pain when doing this, then you need to work within your means by doing something that's less intense or simply just moving rather than stretching in isometrics. So what we're gonna do is use my opposing hand to pull my head into lateral flexion. And as I pull myself here, I am looking to find open side stretching, lateral flexor tissue. I'm just lengthening the range limiting tissue. This is definitely my worst position. I'm getting quite a bit of pain here. I am making the anecdotal judgment call that this pain is worthwhile. It feels like a good type of pain, but that's something that takes experience to make that call. And if you have any doubts, then we simply just move and wait until that tissue heals, and then you would revisit this if you have any doubts whatsoever. And so as I stretch this, I am gonna begin a little bit of rotation, maybe some flexion. I'm simply like searching and loading for whatever stimulus, whatever sensation feels the healthiest for me. And so once I find the right spot, which is maybe gonna be about here, sometimes pulling your arm behind you helps, letting your arm just hang, sometimes extending the thoracic spine or flexing the thoracic spine might help. And I would say right about there is my pain point. Again, take a big deep breath. If I were you doing this, you should be breathing more than I am because I am talking through this as I demonstrate. And from here, I'm gonna begin an isometric contraction. So what I'm gonna do is without moving this arm at all, I'm gonna anchor myself down a bit. I am gonna start driving my head into my hand. So I'm basically trying to do this. And again, I'm getting a lot of pinching here, so we need to lengthen the range limiting tissue, the restricted tissue. And so again, I'm pulling my hand, or pulling my head with my hand, and then I'm gonna begin the contraction. So again, if someone were to walk past me, it doesn't look like anything's going on, but I'm actually driving the right side of my head into this left hand of mine. And I feel the stretched tissue now tensing. It's clenching when it's in a fully stretched position. And all I'm doing is pushing my head into my hand at whatever intensity I can handle. If I had to label it, I would say it's like a 3, 4 out of 10 intensity. I can't really push much harder without pain. And then I'm gonna relax. And then I'm gonna let go and revisit moving through whatever range of motion I have. And again, I'm trying to get deeper into lateral flexion. I'm trying to lengthen the range limiting tissue. That is all we are doing. And another thing we can do as well is as I pull my head, I can begin moving my shoulder blade. And that's another way to kind of just explore your movement options. And so again, my neck, my cervical spine is laterally flexed. And all I am doing is moving my scapula, which I mentioned to start, seems to be a bit touchy. And I'm just trying to move my scapula through whatever range of motion I have in conjunction with the danger zone that my neck is letting me know about. So we're gonna do the same thing with rotation of the cervical spine. I am rotating again to reassess. I mentioned to start that when I look to the right, my right, your left, I can look at that wall pretty easily, even though I get pinching. It's still pretty easy. I am still getting pinching. But now when I rotate to the left, I can definitely look further. I still feel the range limiting tissue, but it's definitely not as pronounced. And so a series of segmentation in the cat-cow, along with a series of stretching with pales and rails, and a series of axial rotations, which is basically a subsection of the neck car, is how we're pairing all these movement options together to stimulate that tissue. So what we're gonna do now is focus on cervical flexion and trying to shorten the opposing side of the injury. Because remember, the injury is on the back side of my cervical thoracic spine area, and we spent a lot of time lengthening that tissue through segmentation, axial rotations, neck cars, and pales and rails, the isometric contractions in the stretch. What we're gonna do now is just shorten the front of the neck. And so this is very difficult for me right now, which would make sense considering the nature of my injury. I feel the back of my neck restricting me. It's a stretch feeling rather than the front side shortening. When I'm doing this type of position, this type of exercise, I should feel the front side shortening exclusively. There should be no range limiting tissue on the back side of my neck. But as I sit here and I tuck my chin and I try to pick my head up further, I can feel tension being driven in the front side of my neck, my anterior cervical spine tissue. Think of this as the same thing as your abs when you do a sit-up into spine flexion. Yes, I feel my abs engage, but in a similar manner, in principle, it's the same thing. I should feel sternal tissue as well as my throat, which is the front of the cervical spine, shortening. As I sit here, and we're just sitting here talking and I'm maintaining this position, I feel the tension in the front of my neck building up. We call it marinating with tension. As I hold this, the tension is coming off of the range limiting tissue and it's transferring, it's being funneled into the shortened tissue. This is an indication of a healthier joint. If you feel lengthened tissue when you're trying to shorten tissue, that is textbook dysfunction. That means your central nervous system is not able to maximally shorten and drive tension into this tissue, and the range limiting tissue is likely inhibiting you. And again, as I sit here, my only job is to funnel tension into the front of my throat. I feel the back of my neck starting to get a little bit tired, so I'm gonna stop there and not bite off more than I can chew. We're gonna do the same thing in reverse, and I can tell I'm a little touchy getting out of that. That is a bit more of a dangerous position for me to be in. But again, all I'm trying to do is gradually expose myself to this stuff over time. We're gonna do the opposite and sit in extension. I can feel that if I'm not careful, I'm gonna pinch an extension. So all I'm gonna do here is rotate away and lengthen this tissue and slowly rotate the other direction and shorten this tissue. I don't really get any pinching right now, which is a good sign. That's a development that's occurred since we started filming this. And then I'm gonna rotate all the way to the left. And again, I am getting a ton of range limiting tissue in the right side of my scapula, cervical spine, thoracic spine. I'm gonna go as far as I can and hold this position. And take a big deep breath into that. And again, we're just exploring workspace, active range of motion that's there, and looking at the current status of the injured tissue in my current situation. And so again, we're empowering you to feel out what the nature of your injury is. If your injury was on the left side, you would be looking to lengthen that injured tissue, because we're looking to follow the length loading progression. So we lengthen tissue and then we contract it and shorten it. And again, as I sit here and talk through this, as I perform the exercise, I can feel myself getting a little bit further, and I'm getting way less range limiting tissue on this right trap cervical spine, which is exactly what we want. The last element that seems to give me a lot of problems is my right scapula, the right shoulder blade. And so the shoulder blades are supposed to move through 4 corners: elevation, retraction, depression, protraction. Protraction seems to give me pain right now. I feel pain in the shoulder blade and up through my thoracic spine as the shoulder blade pulls open. So what we're gonna do is simply just do a scapula car, a controlled articular rotation. As I move my shoulder blade through whatever range of motion is there, I can feel that retraction and depression is a bit limited as well. And I feel my neck a bit as I do this. So my goal is to basically decouple these joints. I'm trying to separate my shoulder blade from my neck and create as much independent movement between these two as possible. And so we can do this, like I mentioned earlier, with some lateral flexion bias, where I am now changing the dynamic between the scapula and the cervical spine. And all we are doing is just trying to provide fluidity to the movement. We're trying to provide synovial fluid. We're trying to provide blood flow to drive nutrients to the injured tissue in an effort to heal it. We can do the scapula cars on all 4s as well, where we're just moving the shoulder blades through whatever range of motion we have available, which would again be protraction, elevation, retraction, depression, and protraction. That doesn't really seem to light up my scapula the same way. But when I'm sitting in this position and I rotate my neck or laterally flex my neck and I move my scapula, I tend to get a lot more pain signaling. And so again, the objective with all of our neck training when we're having an injury, regardless whether it's a neck injury, a knee injury, a hip injury, a shoulder injury, your goal is to stimulate the injured tissue in an effort to drive blood flow to heal that injured tissue. Remember, immobilization is a tool in our tool belt to ensure that you don't re-injure yourself. But immobilization will also hinder your range of motion when you are cleared to return to play and you get back into your training. Our goal is to shorten the recovery time, ensure that when you return to training, you can pick back up where you left off of to the best of your ability. And high quality exercise that's very deliberate is your best bet in rehabbing whatever injury you're going through. Because remember, injuries don't have to come from anything new or anything crazy. I hurt myself last Monday doing standing shoulder press with a weight that I'm very comfortable and familiar with, but 1 or 2 reps went wrong. It's likely that I overextended either from my neck or my thoracic spine when doing shoulder press, and I could assume that based on the restriction I have when I flex. Again, flexion is the most limited movement I have in my neck at the moment, and there's a ton of range limiting tissue through here. So your job as you explore whatever range of motion you currently have available is to try to correlate the injured tissue to whatever movement dysfunction occurred during the exercise that hurt you. Thank you so much for watching the Bodybuilding Not Bodybreaking YouTube channel. If you found it helpful, drop a comment, like, subscribe, share it with a friend or family. That stuff really helps us in expanding our reach to popularizing this training approach, because we know there just isn't a better way to do things. If you have interest in diving deeper into the stuff you just watched, feel free to join our school community. On our school community, we have a lot of additional content. We have an exercise library that has over 200 different movement options. We have programs. We have additional videos that are concepts, lectures, and rants to give you guys a deeper understanding as to how and why we do things. We also have a discussion board where you can get direct access to coaching feedback from me personally. You can also follow us on Instagram, Facebook, and TikTok for additional updates for when we post new content. Thank you again for watching, and we hope it was of use to you.